The Barthel Index is used to measure functional independence and needs for assistance in mobility and self-care. It was originally developed for the hospital setting but has been adapted to community studies. This assessment works well on adult rehabilitation patients with stroke, neuromuscular, and musculoskeletal disorders. The Barthel Index takes between 5 and 10 minutes depending on the time it takes the patient to perform each task.
There is no equipment needed, just the score sheet. There are 10 sections of the index with scores ranging from 0 to 1, 2, or 3. The highest possible total score is 20, with lower scores indicating increased disability. If used to measure improvement after rehabilitation, changes of more than 2 points in the total score reflect a probable genuine change, and change on one item from fully dependent to independent is also likely to be reliable.
Hi Rachel, my name is Jordan and I'm a student occupational therapist. Today I will be assessing you with the Barthel Index, which evaluates your current level of functioning when you engage in a typical daily activity. This could allow us to make any necessary alterations to your routine, allowing you to have the most possible independence despite your diagnosis of Parkinson's disease. Today we'll be focusing on the area of feeding. What is something that you typically eat for a meal?
Cereal.
Cereal? How do Cheerios sound today?
That sounds good.
Okay, I'll be right back. Okay, great. Here are some Cheerios. If you could allow me to observe you eating this meal, I'll be able to clinically assess your level of function to know if we need to make any adaptations or assistance with performing this task. And that will allow you to improve your independence while performing this task. So, go ahead. Okay, thank you, Rachel. So, since you were able to perform this task but not completely well, I would rate you as a 1 on a scale of 0 to 2. And a recommendation that I might make is a weighted spoon because that will allow for less tremors when you're eating. That way you might be able to get more Cheerios into your mouth. How does that sound?
That sounds great.
Okay, great.
Hi, Jordan. It's nice to meet you. I'm Rachel. I'm an occupational therapy student.
Hello.
Hi. How are you today?
I'm okay.
All right. Well, today I'm going to be assessing you using a tool called the Barthel Index, which evaluates your current level of functioning when you engage in typical daily activities. So this could allow us to make necessary alterations to your activities of daily living to allow you to have the most possible independence despite your diagnosis of Parkinson's disease. So I think at the moment we're going to be focusing on mobility. So is there anything that you use or need assistance with when walking?
Yes, I normally have my walking stick.
Did you bring it with you today?
Yes, it's over there.
Okay, great. We can use that. If you would allow me to observe you while walking across the room, you can use this stick and I will determine your current level of function and see if we can do anything else to assist you in making improvements in this area.
Okay.
All right, whenever you're ready. Very good. Good job. Okay, very good. Okay, Jordan, so based on your performance in this activity, I would rank you as a level 3 in the Barthel Index for mobility because you were able to completely independently perform the skill, but you did need to use an aid, so you used your stick to complete walking.
Okay, thank you.
Thank you very much.